You're watching Cetome TV. Knowledge is power. Okay, Maria has a question. My daughter has osteosarcoma.
Okay, it's a bone cancer.
All right, she's been fighting that for 6 years. She doesn't say how old she is. Osteosarcoma, fighting for 6 years with chemotherapy, surgeries, and radiation. Her question is there anything better than the treatment that they've been given?
Yes. I had a good friend in my early 20s that had osteosarcoma. He's doing fine now, but he went through the same thing. He lost his leg, and it was a big inspiration to me getting into cancer research. But osteosarcomas are typically well treated if they occur in the limb, because you could just remove the limb and that typically removes the stem cell niche too. If it's happening in a young person, there's going to be an inherited genetic component once again. And so, genetic testing is really important. I think in this day and age, osteosarcomas will respond well to chemotherapy and surgery and radiation therapy. But yes, there's always something better, and it's going to be targeted or, some sort of precision medicine.
Yeah.
So genetic testing once again.
If you were to try to attach a percentage to the number of time in the last decade that you have not been able to find a better option than what's been prescribed?
It was quite a few years ago. It was in the beginning of, beginning of precision medicine and sequencing, and we were using fairly small panels at the time.
So you'd have to go back.
I'd have to go back
10,
probably
9 or 10 years?
7 years, 8 years, and there's only been 2 cases since we've been doing this.
Wow. So 2 cases in 10 years, and the last one 7 years ago?
Actually, there was one other case recently where there was no genetic mutations on the panel.
Interesting.
But we're still not sure if that's a real cancer, and the pathology was suspect, and whatever the person had hasn't progressed yet.
Right. So you're just keeping an eye on it.
We're keeping an eye on it right now.
Right. Yeah. So maybe 3 cases in a decade where adding this molecular testing, this genetic testing did not produce better treatment options.
Yes, exactly.
So that's some pretty serious numbers there. Yeah. So Maria, you may want to explore that for your daughter then.
Definitely.
Thank you for watching Cetome TV. Subscribe below and stay informed.